I know I'm talking very different from what the other speakers may have spoken so far, but I think this is very relevant today. And I'll try to make it's an overview essentially without going into too much details, and try to finish as soon as possible so that we adhere to time also. So all of us in this audience, I'm sure, are aware of the spectrum of radiation that we deal with in life, which actually is determined by the wavelength as well as the frequency, classifying it broadly into non-ionizing and ionizing radiation. Now, this is important because humans per se are exposed to this radiation, whether intentional or unintentional. The intentional exposures as we see them today are essentially diagnostic in the medical field, which could be simple X-rays, CT scans, isotope scans, or they could be related to therapeutic interventions with radioisotopes or with external beam radiotherapy, or it could be unintended as we get from the environment, radiation emitting devices. It could be occupational or various other radiation hazards. Now, in the environment, a human being is exposed to various sources of radiation. We have radioactive potassium within the body itself. And in addition, the flora and fauna around us, as well as the cosmic radiation, contribute to this particular source of radiation to the human body. Now, it's also important for us to know what is the contribution of all these sources of radiation to the human body, simply because it's quite ironic to realize that most of it that we get as of today, within the permissible limits, actually come from the diagnostic X-rays. Now, it's important also to realize how radiation works in the human cell. It works essentially by two methods, either direct or indirect. The direct essentially means double stand breaks which cannot be repaired appropriately and at the right time, and indirectly by various chemical mechanisms, essentially the free radical damage. Now, it is also essential to understand that radiation, once received, or any dose of radiation is not capable of causing any effect in the body, and hence the various effects of radiation could be broadly divided into either stochastic, that means there is no threshold, that means the probability increases with increasing dose, for example carcinogenesis, that is the ability to cause cancer, or non-stochastic, that is there is a definite dose response relationship like we see in therapy. Whereas the dose increases to a particular part of the body, we see radiation, acute or late radiation reactions. Now, the effects of radiation on the human body are also a function of the part that receives the radiation, the volume that receives the radiation, the organs within the human body that receive radiation, and the volume of the organ receiving the radiation and the effect that we are studying. For example, if we were to consider the salivary glands in the face and neck area, if you radiated a larger volume, there was more likelihood that you would see dryness of the mouth as we typically see when we treat head and neck cancers. Or if you were to treat the brainstem, which is a part of the brain controlling important functions in the body, again, if you were to treat larger volumes, the chances that we can cause irreparable damage would be much higher. Another important example for us as radiation workers is the concept of the white blood cells, that is the blood cells in the body, of which the pelvis, the human pelvis, is a large store, especially in the adult. And here it is important for us to realize that amongst the different blood cells that we have in the body, it is the small lymphocytes that are exceedingly sensitive, and this also is a function of the dose that is received by these cells or a part of the body. Also, several effects that we see may not be a direct effect of the radiation received by the entire body or a part of the body, but because it affects a part of the body that is producing hormones, that are substances that regulate functions in other parts of the body. Also, the clinical manifestations of any radiation reaction is again a function of whether it is localized radiation, that is whether radiotherapy is given to a part of the body or whether it is given in the entire body. So as you can see in this picture, you can see a hyperpigmented area, that is a darkened area, which is the area that has been treated. The area that hasn't been treated will show no effect of radiation, vis-a-vis this man who is being treated completely with an intention. Also, the various kind of effects of radiation, especially to the entire body, again are a function of the dose that is received by the entire body. Essentially, the moment the entire body receives a dose of about 2.5 to 5 gray, we see what is called as the hematopoietic syndrome, which means that the blood cells in the body are affected. If the dose becomes higher, we see effects essentially because of the effect on the gastrointestinal system, that is our food pipe. And then if the doses are much higher, of course, all the events that occur and the cascade is essentially because of damage to the central nervous system. And this actually is again a table that shows you a similar thing, the manifestations of these various doses and to the entire body. Now, coming to the medical use of radiation, as I've already told you today, if you compare to the early 1980s vis-a-vis 2006, in the 80s, most of the source of radiation to the human body was from the background. That's about 83%. In the 2006, what was realized was that most of the radiation that the human body received was actually from medical use. And this is important to keep in mind because as we go more and more advanced, there are various screening programs that have come into practice and of course which contribute to the radiation that the human body receives. Of course, we owe all this knowledge of X-ray radiation to this man, that's William Conrad Röntgen. And these are simple X-rays that can be taken and which are very essential as of today because they help us diagnose, as well as if you see the picture on the left, it's essentially a picture of verification during actual radiotherapy treatment. So X-rays have become an integral part of our life. Also, as we've advanced, we've developed the use of radionuclides, that's radioisotopes, for the precise diagnosis, that is staging of treatment, as well as staging of disease, as well as so also in various certain structures like the cancers of the colon, that's the distal part of the food pipe, these isotopes are used to monitor response to treatment and also afterwards detect early recurrences. Now, if we look at what this all means, it's simply that when we look at the various diagnostic procedures that are carried out in the human body, there are low to minimal and sometimes, of course, negligible doses of radiation that are received by the human body. And of course, depending on the procedure and the volume of the body that is exposed to these radiations, we have impacts that we may possibly see in the long run. To summarize about diagnostic procedures, there's definitely some risk as we've seen from the previous table, but this is minuscule when compared to development of cancer in the normal population. This risk somehow is higher from data from the Western population simply because of higher frequency of surveillance diagnostic scans. However, we really do not have any data from India. And we presume that this risk may be somewhat lower than that from the Western world, as surveillance and screening scans are routinely not performed, and we really do not have any screening tests carried out in the population as of today. Now, coming to therapeutic radiation broadly can be classified into two broad themes. That is teletherapy, when radiotherapy is given from outside, either with a machine like a linear accelerator or a telecobalt unit, or brachytherapy, when the source of radiotherapy is placed within the body, and depending upon whether it is within the tissues, within body cavities, or in contact with body cavities, various kinds of brachytherapy can be performed. Now, in radiation therapy, when we use it as a treatment modality, mind you, the aim of any treatment is to be able to give as high a dose as possible to the localized area of disease and protect the adjacent normal structures, thereby trying to achieve an optimal therapeutic ratio. Now, we have various machines that are capable of doing treatment today, from the conventional age-old cobalt machine to the more sophisticated linear accelerators. And of course, there are various planning machines that are involved also in helping us plan and treat our patients better. Now, this is again a collage of the various machines that are available today, and this just shows you the amount of sophistication that is possible in delivering radiotherapy today. In brachytherapy, it is possible for us to be highly conformal and treat only localized areas of disease so that we can reduce the dose as thereby the side effects that we see in adjacent normal structures. Now, radiotherapy is actually an important component of the treatment of most cancers More than 70% of cancers actually are treated with radiation therapy at some point in time, and this is a list of the cancers that definitely require radiotherapy. It could be for cancers of the head and neck region, like I've told you, for the tongue, for the breast cancers. It could be used for cancer of the uterine cervix, which is a leading cause of cancer in still the rural population within India, or for other areas in the gynecological malignancies. It can be used for cancers of the lungs, for the food fight as a part of internal radiotherapy as well as external radiotherapy. Now, having delivered radiotherapy, are there any risks? Yes, there is always a worry in the mind that probably we would, in the long-term survivors, see certain radiation-induced cancers. However, what has evolved from all these years of practice with external beam radiotherapy is that it could be only about 1% to 1.7% over about 10 years. And this is again another table showing you the risk, percentage risk that is attributable to the radiotherapy that has been given. And what we could summarize from this data is that less than 10% of second cancers can be attributed to the radiotherapy in long-term survivors. And the risk after fractionated radiotherapy actually increases proportionately with the increasing duration of survival, and it is higher in childhood survivors than adults. However, there are various important factors that contribute in a majority of second cancers, and we shouldn't forget lifestyle, alkylating agents, and genetic factors. And keeping in mind a very important concept, that is ALARA. Since we know that radiation is an extrinsic agent, we need to keep the dose of radiotherapy as low as reasonably achievable, and this can be done by minimizing time, maximizing the distance, using shielding whenever possible, and of course reduce the amount of radioactive material. I don't think I will go to all this because there's hardly any time. But another important concept that we need to keep in mind is that there are certain parts of India which have very high amounts of background radiation. Very many of you would have heard about Karunagapalli. But what is important to realize is that when we compare the incidence of cancer in Karunagapalli versus other areas in the in India itself, we realize that the age-adjusted rates are actually not higher as compared to the other registries within the country itself. And of course, surprisingly, we also see that the highest incidence of cancer itself in India is in the northeastern region, and where we don't have any nuclear power plants or neither any sources of radiotherapy. Also, what is important to keep in mind is that we have a very high incidence of cancer, especially the head and neck region, in males. And these are essentially tobacco related, and more than 70% of these patients present with very advanced disease. I will quickly just go to my conclusion slides, and where I just conclude by saying that it's important for us to understand that there is a significant interface between radiation and daily human living. Significant increase in the use of radiation medically, both for diagnostics as well as therapy. Significant exposure of humans from environmental sources also has to be kept in mind. With strict compliance of radiation protection guidelines, the benefits of radiation and its use outweigh the risks associated. Thank you.